There are people who contact me on social media asking for a second opinion when their doctors have told them that they are planning to have a CS on them. I'm here to tell you that CS is saving lives. Caesarean section is very important. Should a doctor tell you that you need CS, relax. Ask the doctor, why do I need CS? Let the doctor explain. If you have any more questions, you ask, so you understand why at that moment the CS will save your life and the baby's life. In this video, we are going to talk about reasons why we doctors have what we call planned CS and emergency CS on our patients. If you want to find out more, please continue watching this video. This is Time with Dr. Adams. Time with Dr. Adams. Hi there. Welcome to another episode of Time with Dr. Adams. If today is your first time on my channel, welcome. My name is Dr. Saki. You can call me Dr. Adams. In today's video, we are talking about reasons why doctors have been suggesting CS to our clients. So basically, the whole world, Ghana Health Service, Ghana as a whole, Africa, and then the whole world, we doctors or health professionals need mothers alive and babies alive as well. So whatever methods we will get baby out alive and mother too alive, that's what we choose. So ideally, when a woman goes into labor, we are all thinking vaginal delivery. And of course, but then this is life. Sometimes things happen. These are some of the things we are going to talk about. Please, I said I'm going to talk about some of the things. If you do not find the reason why your doctor is going to operate on you, it doesn't mean your doctor is lying. I'm just going to talk about the most common ones, reasons why we do have CS on our clients. Basically, we have two categories of CS. We have what we call planned CS. When I say CS, of course, I'm talking about Caesarean section, all right? So we have planned CS. That is, you are not in labor yet, but your doctor has seen that you cannot deliver per vaginum, that is through your vagina. Because of some situations, your doctor is not going to allow you to deliver through your vagina. So with that, we plan before you get into labor. Now that is what we call planned CS. Planned CS is also called elective CS. Then we have what we call emergency CS. With that one, it's unplanned. You didn't know you were going to have a CS, you came in or you were there, you got into labor, we all thought you could deliver through your vagina, and then suddenly something happened and we realized you couldn't give birth through your vagina, so then we have to do a CS on you. So let's head right into it. Let's start with a planned CS. Let me use one of the most commonest ones. That's when the woman is short, or we are thinking the pelvic is small, the pelvic area is small. Depending on the hospital you give birth in, they have protocols. So I worked in this hospital and we're having a doctor's meeting one day, and one of our specialists was giving us a protocol, and she said, oh, so when your patient comes in and she's as short as Abigail, I was only Abigail in the room, she's as short as Abigail, you just know that definitely she's like 150 cm, and then her hips is also small, maybe baby cannot descend. And then it just came out of me, I was like, please, so I am not 150 cm, I'm more than 150 cm and my hips are wide. Everyone just burst into laughter. Okay, so when you look at the stature of a woman, sometimes you can predict that the baby would not be able to be born through the vagina. Yes, and we say this, we predict this also through the size of the baby. That is why it's important that as you are pregnant, through the 3 trimesters, you are having a scan done, so that we'll be able to tell how big your baby is. If we realize the baby is too big, we look at your stature and then your pelvic area, we can decide that no, this one is not going to be possible. Also, when the placenta isn't positioned well, when we say the placenta isn't positioned well, the placenta is supposed to be at a place. I'm not going to bore you with medical terminology, but then the placenta can move abnormally, and when it moves abnormally, it can come and cover the opening of your womb. That's the cervix, and that's where the baby has to come through. And remember, the placenta has a lot of vessels. If the placenta is blocking your cervix, where baby is going to come through, it means placenta will come out first, which is not the ideal, because placenta is what is feeding baby. Remember, blood is going through it, is highly vascularized, so placenta cannot come out before baby first, then placenta follows. So if you realize your placenta has moved from where it's supposed to be and is located near or around the cervix, we decide that you need a CS, because this can cause serious bleeding issues. It can cause cessation of oxygen to the baby's brain as well, can cause serious complications for baby and even for mother, and it can lead to their death. Also, when we realize that the baby is not lying as it's supposed to be. Remember, ideally a baby is supposed to be born with head first. However, sometimes the baby is coming with the buttocks. Yes, as you are pregnant and as you've been doing the ultrasound, if we realize that the baby is breached, that's if the baby is coming with the buttocks, we give you time. Even sometimes some people try to maneuver and turn it. However, if you are close to your date and still the baby is breached, we think it's ideal. Do you know why? Baby's head is the biggest part of the body, and so when it comes first, it opens the cervix and gives the rest of the body easy access. Now, if the bottom comes first and it gets to the head, it will be stuck, and this can cause serious complication and even lead to death. Also, a baby can be lying transverse. Yes, transverse is when either the head is to the left or to the right. Yes, and with that, definitely we need to operate on you. Sometimes as well, there are fetal or maternal conditions that will not allow baby to be born per vaginum. With all this, your doctor will sit you down and talk to you concerning it. Like I said, if you have any concerns, ask your doctor. There's nothing wrong in seeking for a second opinion. However, if you sit there and the doctor says you're going to operate on you and you don't understand, then later on you make it seem like the doctor kind of forced a CS on you, now that is unfair. Always ask questions. And with planned CS, all these things I've spoken about, we usually see them if you are coming to A and C. Now, another reason that I forgot, let me chip it in. If you've had CS 2 times already, definitely in Ghana, most of our the hospitals, they are protocol. Definitely, if you had 2 CS, we are going to operate on you on the second one. The next one, sorry, of course. So if you've been coming to A and C, this is when we will realize all the petty issues, and we will discuss with you why we think vaginal delivery will not be best for you. Remember, the end goal is you alive and baby as alive as well. So whatever means we have to use to get to this conclusion, that is what we will use. Now let's talk about emergency CS, that's unplanned. Fine, these things happen, like I already said, this is life, things happen. So suddenly, you are home and suddenly you realize that your water has broken, or you are in labor, you start having contractions. You get to the hospital and you are bleeding. Bleeding issue is an emergency. The doctor is going to examine you. If they realize that it is what we call placenta previa, that is what I explained earlier on, that the placenta has moved and is covering the opening of your womb, that's the cervix. If they realize is that we have degrees of that, whatever degree it is, the doctor will make a decision according to it. If we realize is that, then it's important you have a CS. We also have what we call placenta abruptio. That is when the placenta prematurely detaches itself from the lining of the womb. It's not supposed to do that. If it does that, you are going to bleed. And please, most of the time when we see these cases, the women want to call home. Sometimes they are rushed in. It's okay if you want to call home, but bleeding emergency, baby must come out as soon as possible. And if the doctor decides CS is the best way, please. The doctors aren't demons. We are also religious in our own way. Yes, you can talk to your prophet, you can talk to your religious leader, your imam, or whoever is your religious leader. Whatever the issue is, please understand when we say it's an emergency CS, especially if you are bleeding. You can lose your life like this, and baby's life as well. We do know emergency CS2 can come through what we call failed induction. Induction is when you've gotten to the time when labor is supposed to set in, but it's not setting in. So we give you medication to start labor. Per the protocol of the hospital, there are a number of times that we'll give you this medication. So still, even after we've given that number of medication for labor to be induced, still you are not getting contractions or labor hasn't started. Now that is what we call failed induction. With this one, we'll have to come in to help, because the longer it takes, complications can set in, especially for baby. Remember, when you are in labor, you are not the only one suffering. Baby is also going through the stress. Remember, imagine a little baby jogging. The baby is also going through the stress. So we are not just thinking about you, we are also thinking about baby's health as well. Let's move on to what we call fetal distress. Now, remember I said when you are in labor, you are not the only one, quote unquote, in an uncomfortable situation or suffering. The baby is also kind of pacing. Imagine a little baby going for jogging. So fetal distress, if you've been around someone who is in labor in a hospital setting, you will notice that we'll use an instrument, a wooden or a plastic one, to be checking something on the woman's abdomen, or a machine. Yes, we are checking the heartbeat of the child. If we realize the heartbeat is too fast or too slow, that's what we call fetal distress, and that is an emergency. We can just lose baby just like that. Yes, so if you are in labor and your doctor or your midwife tells you that baby isn't breathing well, or baby's heart isn't beating well, whatever they tell you, they say baby is in distress, please allow them to get baby out immediately. Baby isn't doing well, and the longer you wait can cause complications. It can cease oxygenation into the baby's brain, and this future you realize that there's something wrong with your child. Later on, child will be taken to NICU and will have severe complication later on. Birth asphyxia can come with what we call cerebral palsy. That's an example. So please, fetal distress is an emergency. Then as well, we have obstructed labor. This is when labor has started, but then we realize that the head is still not descending as it's supposed to. Yes, we did not pick up that maybe your pelvic area is small, or baby's head is big, or baby is a huge baby. But then, however, whilst you're in labor, we just realized that baby is supposed to descend, but baby isn't descending. We call it the head. You realize that when the midwife or the doctor goes into your vagina to check the dilatation of your cervix, they say, the head is still high. It means baby is not descending as it's supposed to. Yes, the longer we wait, baby is suffering, and it can cause other complications as well. Then as well, I would say, please, when they say they need to get baby out, please allow. You might also have heard that someone said, oh, I went into labor and I was helped. Assisted labor, they did vacuum or they used forceps. Yes, that can happen. It can happen that the head has descended, however, the mother's pushing ability, or there is just a form of some obstruction, and they think they can use vacuum to help baby out, or they can use forceps to help baby out. They will do that easily for you, but it does not mean that the fact that they did it to patient A, they are going to do it to patient B. Everyone's case is different. Like I even said earlier on, the placenta previa, I spoke about the location or the movement of the placenta. We have different types. So maybe your neighbor had type 1. And with type 1, there's no need for a CS because we can manage it. But someone might have a different type, and with that one will result in an emergency CS. Whatever it is, I keep saying, do not compare yourself to someone else. We are all different. Do not compare yourself. You have a peculiar case, I have a peculiar case. The body might be similar, but we go through different conditions. If you have any questions, just talk to your doctor. There's nothing wrong in asking for a second opinion, but when it's an emergency case, please, the decision lies on you. If you are not fast, if you don't act fast, we can lose baby. So CS is saving lives. So CS is saving lives. It depends on the condition you find yourself in. I'm sure your doctor, just like I'm sitting here and I'm telling you that we all want you alive and baby alive. CS is not demonic. We all have our spiritual beliefs and all that. Like I said, you can pray with your spiritual head and all that, but whatever it is, think about yourself and think about baby too. If you have any questions, leave it in the comment section below. Let me know if there's any topic you want me to cover. Let me know as well. Thank you for stopping by. If you haven't subscribed yet, please subscribe and be kind to share this video. All right, be kind to each other and still, yes, more. Thank you.
Time with Dr. ADAMS.